The physician joins the room where a father, 45-year-old male, and his daughter, 15-year-old female, are sitting. The daughter is nervous and the father is frustrated.
You let me handle this, okay?
Hey, is this Mr. Smith?
Yes, yes.
All right, and this is your daughter, Miss
Yes.
Jennifer?
Jennifer.
Okay.
Jennifer, say hello.
Hi. Well, nice to meet y'all. I'm Dr. Patel.
Hi.
What's going on today?
So, actually, she's been doing things that a little girl like her shouldn't be doing. She went and got pregnant. Do you have anything to say for yourself? Of course not. So, we're here to make sure that we get this all situated so that she doesn't ruin her life.
Yeah, definitely. You're way too young to be pregnant. How far are you? Or when was your last menstrual cycle?
When?
June? Okay.
June.
All right. What day?
The 1st of June?
I can definitely understand your disappointment, Mr. Smith. We can definitely work on this, okay? You're still within the time range.
Oh, thank God.
Yeah.
Oh, thank God.
Well, we can correct this, okay?
Yes, please
Alright.
fix this.
All right, so we have to get some lab tests done to confirm everything. Are you ready, Miss Jennifer?
She's ready.
Okay, all right. Well, we'll get the nurse right in with you.
Thank you.
This is an example of how not to handle this particular situation. Jennifer's choice has not been taken into consideration. Let's try again.
Hi, Mr. Smith?
Yep.
Ms. Jennifer Smith?
Jennifer, yeah.
Okay, my name is Dr. Patel. I'm gonna be taking care of you today.
Alright.
All right, what seems to be going on though?
So she's been doing things that a little girl like her should not be doing, and she just went and got pregnant. And we're here to get this situated. She just can't ruin her life like this.
Absolutely. Well, we can discuss some options about what we can do with the
Please.
pregnancy.
Please.
But both of us have to be all on board about it, okay?
Both
so
of
we
us?
gotta,
All of us? Right?
yes, all of us.
All of us.
So, mom's dad, and the doctors, okay? All right. So I have a few questions I want to ask. Do you want to answer them in private, Miss Jennifer, or would you like? Is it okay to go ahead and ask them now?
I'll prefer that.
After this conversation, can I come back in and see what's going on, or do I just have no say at all?
Well, you'll definitely have an influence, but we're gonna keep you in the loop, okay? All right, we'll discuss this outside.
This is...
The conversations that you and I are gonna have, we're gonna keep them as private as we can. If you don't want me to share certain things with your father, we can work with that. But there's some things that we are gonna have to involve him in, okay?
Yeah.
Okay. All right. But first, I want to just ask you, like, what happened?
Woo! So, I've entered a pact with my friends. A pregnancy pact. We're all gonna get pregnant within the next year. And of course, I want you to be my doctor.
All within the next year?
The next year.
How
All
many
of
people are
us.
we talking in this
There's
batch?
4 of us.
My goodness, Jennifer. That's pretty serious.
Our families are gonna help us, of course.
Okay. So we really have to think about how you having a child is going to influence the rest of your life.
Pregnancy pact.
Confidentiality is the idea that the personal and health information a patient reveals to a clinician is private, and that there are limits on how and when the information can be disclosed to a third party. Adult patients' confidentiality is subject to few restrictions. For adolescents, however, confidentiality is limited, in large part because of our ethical duty to provide care in their best interest until they have the legal right to make decisions for themselves. The case of Jennifer and Dr. Wilson illustrates the difficulties inherent in navigating confidential care for adolescents. Question: who do you think has the authority to make the decisions in a situation like this? A young medical student, Sarah, is talking with Dr. Adams, a senior attending physician.
Dr. Adams.
Hey, Sarah.
Yeah.
Okay. Sarah, I'm glad I ran into you. I need your help with something.
Shoot, go ahead.
Okay, so we're conducting a research on a specific patient who has a condition going on,
Okay.
but we need some pictures, and I think you'd be perfect for helping with that.
Yeah, I'm up for it. Yeah, we need to get the patient's consent first, though.
Nah, we're on a really strict timeline. We don't need to bother the patient with that. Just go in, grab a couple of shots discreetly, and just send him on over to me, okay?
All right, I'll do it. Yeah.
Okay, thanks so much.
Jennifer? Hi, I'm your doctor, Sarah. We'll be taking some pictures for you for research purposes. Is that okay with you?
I guess.
Yes. Okay, perfect.
What are these pictures for?
Oh, they're for research purposes to better understand your condition so we can improve your treatment.
Oh, okay.
Yeah. Thank you so much. We'll be right back with you. So what do you think? Nice, right?
Yeah, these are pretty good. I'm so proud of you,
Thank
Sarah.
you, thank you.
I'll make sure you get that A.
This is an example of how not to handle this particular situation. It goes against the non-maleficence principle that every health professional should try to uphold. Let's try again.
Oh, Dr. Smith.
Sarah,
Yeah.
I'm glad I ran into you. I need to ask you for something.
What's up? Yeah, we need.
All right, so you know we've been conducting this research,
Okay.
and we need some pictures of the patient because we're on a time crunch at this point. Could you go grab some?
Sure, but don't we need the patient's consent first?
We're really running out of time. This is really absolutely necessary for this research.
Yeah, I get that, but I don't think that's the right thing to do. I tend to hold patient confidentiality and respect above all else. I don't know.
Sarah,
Yeah.
this is crucial. You understand this can jeopardize your future and your residency.
I understand. Yeah, I kind of understand that. But, yeah, I think this is more important than that. You know?
Oh yeah, you think so?
Yeah.
More important than the research?
Yeah.
All right, we'll see about that. But I respect your decision.
All right.
That was a test, and he passed.
This is a much better way of handling this dilemma. It respects the patient's right to consent while remaining within ethical bounds. The underlying principle of consent isn't particularly complicated. Patients have a right to make an informed, voluntary decision about their care. That means they need to know the risk, nature, and benefits of their options, which includes declining treatment. How would you handle a situation as a medical student if an attending physician demanded that you take a picture of a patient without first getting their consent?